me. Grandma sounded strange when she spoke. Then they had to ask, what if my grandma's having a stroke? I think I better ask that. Time to call 911.
Alrighty, you are listening to 580 KIDOam. I'm host Brenda Harper, and this is Peace of Mind, the program that talks about the many pieces of physical, intellectual, and emotional health. And we wanted to play that catchy little tune for you so you can learn to recognize those signs of stroke. And we have with us today from St. Alphonsus Hospital, Mary River, and also Nicole Whitener, I believe. Is that correct?
Yes, that's correct.
Okay, I got it right. Thank you so much for being here and being part of the program. And let's talk a little bit about stroke awareness. And what is it? How important is this?
Well, Brenda, 795,000 Americans will have a stroke this year. And
Wow.
one of the most important things about stroke prevention is being aware of your risk factors. And 1 in 3 adults have high blood pressure, and high blood pressure is the #1 risk factor for stroke. Controlling your high blood pressure can greatly reduce your risk of having a stroke. Unfortunately, the American Stroke Association estimates that 21% of people who have high blood pressure are unaware that they have high blood pressure, and they are at a very high risk for having a stroke.
High blood pressure and diabetes, those are 2 major risk factors. And they're pretty easy to go looking for. I think that any doctor that I know would be happy to screen a patient who's concerned for those risk factors. The lesser risk factors that are still risk factors would be things like high cholesterol or hypercholesterolemia. Smoking is a big risk factor, actually. Overweight, obesity, and sleep apnea is a risk factor, and probably too much alcohol is a risk factor.
Men are more likely to have stroke than women are. Men tend to have a higher rate of hypertension or high blood pressure, and tend to have higher rates of high blood cholesterol. But women have additional risk factors for stroke, and a couple of those are birth control pills. Well, one of the main ones is being on birth control pills or taking hormones. So you really want to consult your physician if you take any of those medications, birth control pills or hormones. Those can increase your risk for stroke.
And those are, so if you think a person is having a stroke, you'd say to them, tell me your name or talk to me, and if their speech is slurred or if their face is droopy on one side, if they smile, you ask them to smile and show you their teeth. And then if you ask them to lift their arms up and they can only lift one arm up or the other one kind of droops down after they get it up, then you call 911.
And we always like to recommend that people call 911 because the paramedics that will transport you to the hospital are trained to deal with stroke very early on, and the actions that they take very early in your stroke can have a tremendous impact on your overall outcome.
So Mary, what is the most common treatment?
But we have a team approach to stroke, and so when a patient comes in, first we call it a brain attack, and that mobilizes our team. The ER doc sees the patient, and they get them as quickly as they can to the CT scanner. And as part of the CT scan, we do a CT angiogram, so we can look at the major vessels of the brain. And what we're looking for is some early signs of stroke, which then do in part determine whether we can intervene, and also to look at the large and medium-sized vessels to see if there is a clot present in an area where we can retrieve it, depending on where the patient is time-wise within their stroke. Screening. Screening first.
Right. So one of the things that St. Alphonsus does on a regular basis is we have stroke screenings, and we, for example, if we have it, say, at Eagle Health Plaza, we will invite people in the Eagle area to come, and it's free to the public. And they get their blood drawn. They have to come in fasting because we check their cholesterol, we check their lipids, we check their glucose, and then we check their blood pressure, and we go over their lab results. And people who have high cholesterol or high lipids or high glucose, we will give them a phone call and just make sure that they're aware that they may have a risk factor for stroke. And we do these screenings throughout the valley. We do probably, 6 a year. and that we always make them free so that people can come and know their risk factors for stroke.